Create Connects. Today we will be covering singing and group singing. Before we start, I'd like to acknowledge that all of us here on this platform are located somewhere on Aboriginal land across this vast place that we now call New South Wales. I live and work on Gadigal and Bidjigal lands, and I pay my respects to elders past, present and emerging. My name is Beck Dean and I'm a Senior Manager of Policy and Partnerships at Create New South Wales. My colleague Ashley Collis is also on this platform and she'll moderate your questions and also provide some links as we go. So this is a slightly different platform from the one that we've used before, but the basic functions are the same. So you'll find that there's a chat window on the right-hand side of the at the bottom of the screen on the right-hand side, there's a little chat bubble. You can click on that. I just noticed that someone pointed out that the slide says 2020, and yes, I still think it's 2020. Sorry, everyone, change that. You can write into this chat box, say hello, tell us where you're from, but also you can write down your questions there. And so we're going to have a Q&A after I cover off the main points of the changes that have happened over the last week. So Aaron and Michael from AI Media are captioning this webinar as we go, as well as we're recording this webinar, so you can point people towards this information over the next few weeks. And the links to the captioning can be found within the chat box. So basically, I'm going to split this webinar into two parts. For the first part, I'm going to run through the legislation, which has changed, the New South Wales health checklists relating to singing. I'm also covering advice for schools, the blanket exemption for professional organisations, safe work advice, and another exemption process if this isn't enough for you to take in. So the second part of the webinar, for those of you who've never done a COVID safe plan before, I'm going to take you step by step through what is available for that on the New South Wales government website, and what you have to do to sort of lodge that plan as well. So that might be interesting for people who've never done that before, and for others, you can feel free to leave at that point. Okay, so let's press on to the first slide. So the legislation around singing actually changed on the 26th of February. So prior to this time and throughout all of 2020, there wasn't any legislation on singing, it was only advice. And so it wasn't, singing wasn't prohibited, but it was strongly advised that you didn't sing in particular circumstances and only within certain restrictions. So this is now law. So as of the 26th of February, singing is now in the Public Health Order, gathering a movement. And if you wanted to look into this, you can actually go to that Public Health Order. I've put the link there. Maybe Ashley, you might be able to drop it into the chat. But it's in clause 15. And so this is basically all of the information that is contained about indoor singing that is not related to religious uses of singing. So go back. Can you go back to that? Oh no, you are there. Sorry, sorry. Excuse me. Okay, so the direction of the minister about indoor singing says that the minister directs that the occupier of premises in which there is singing in an indoor area must ensure the maximum number of performers singing is 30. So there's also a note under this. So that's the entire bit of legislation around singing. And there's a note under this that says that other relevant matters are addressed by the COVID-19 safety plan required by clause 6 and the associated COVID-19 safety checklist. So basically, you'll find more information related to indoor singing, which is not part of the legislation, but advice within a COVID safety checklist. So basically, there's two things to be clear about here. Now there is actually legislation about singing, and the legislation says 30 people indoors. The second part of that is that as a venue, you would be required to write a COVID-19 safety checklist and to cover off singing in your checklist if that's something that happens in your venue. So there's more on this, and so we'll go to the next slide. Thanks. Okay, so the checklist information says that no more than 30 performers should sing indoors. There is no recommended cap on performers singing outdoors, and all performing singers should face forwards and not towards each other, have physical distancing of 1.5 metres between each other and any other performers, and be 5 metres from all other people, including audience and conductor, where practical. So in indoor areas, audience members should not participate in singing or chanting. So hopefully that's pretty clear. I did quickly check in on education because I know that a few of you would be working in the education context. So there should be distance of 5 metres between a group of performing singers and the audience where practicable, and that there are no recommended limits on singing groups, including for in-class educational activities such as group repetition, chanting, recitation or singing activities. So that's the information that's currently available on from the Chief Health Officer in relation to education and singing. So as part of the new public health order in relation to singing, New South Wales Health also put together an exemption for professional organisations that was enacted on the same day. So this basically means that if you are an organisation that is employing at least one person, then you can be exempt from the order of 30 people indoors if you undertake certain steps. So basically, the exemption applies and is subject to the following conditions. So number 1A, the occupier must take reasonable steps to ensure patrons or customers of the premises do not participate in the singing. And B, that the occupier is satisfied that there is a COVID-19 safety plan in place in respect of the exempt performance. And actually, if we could move to the next slide, because this continues. So an exempt performance means a performance which includes a rehearsal for a performance, where an organiser of the performance has responsibilities on the Work, Health and Safety Act of 2011 in relation to the performers, and that the organiser of the performance has developed a COVID-19 safety plan that addresses the following matters. So it's basically the provisions that you address through any COVID safety plan, which is wellbeing of staff, physical distancing, hygiene and cleaning, and record keeping. And in relation to singing, the physical distancing includes singers being at least 5 metres from the audience and taking all reasonable steps to optimise ventilation. So those are the two issues. So basically that means that if you're a venue and you are hosting performances or rehearsals, that you are exempt from the 30-person rule inside if you have a COVID-safe plan, and you're undertaking to address those issues in relation to singing in that physical distancing part of your plan. So I'll talk a little bit more through the safe work processes now. So this is advice that we got from Safe Work last year, and it's basically the same thing applies. So professional organisations, and that includes any organisation that is employing at least one person, it provides that you have sort of contingencies in place. So that you're subject to work, health and safety legislation, and that any person conducting a business or undertaking has responsibilities on the work, health and safety legislation, and is required to consult with others to manage the risk. So if you go to the next slide, Ashley. So work health and safety principles should be applied to minimise the risk of transmission of COVID-19 among performers, staff and audiences, for example, through increased physical distancing and improved ventilation in indoor settings. And the organisations should implement comprehensive COVID-19 safety plans. The onus is on a professional performance organisation in consultation with their staff to develop appropriate plans and ensure compliance with such plans. And go forward. So purpose-built venues and their associated permanent workplaces may have an opportunity to implement specific work practices and engineering controls that may not be viable for employee performances. These tailored controls may help augment the approach to meeting the necessary public health outcomes. Where tailored controls are employed, New South Wales Health recommends that organisations obtain specialist professional advice to verify the effectiveness of measures. So moving on. So what does this mean? So it basically means if you're an organisation that is undertaking work with singers, which means that your work deviates from what's inside the public health order, but is provided within the exemption that we've just gone through, you need to manage your risk within your workplace. So you need to develop and submit a detailed COVID-safe plan for your workplace, and that you should get that advice checked. So it could be an independent epidemiologist, of which there are very few, unfortunately. It could be an occupational workplace health and safety officer, or it could be probably your board. If you're a professional organisation, there's probably lawyers and risk managers and all sorts of people on your board that can look at those plans and sign off on them. So the other part of this is that you need to inform everybody that's involved in your work about your COVID safe plan. So it's no use having a plan if you're not actually communicating this to your staff, to your volunteers, to your workers. So they need to know the risk management that you're undertaking and to be part of that journey with you. So if we move on. Okay, so this is a big question, is what if none of this complies? What if I don't comply with this? None of this applies to my group. So I guess the main issue here is that what New South Wales Health are trying to do is to cover off most of the bases. So anyone who falls outside of these now, because it's in the law, you are now able to apply for an exemption. All of last year, the advice around singing was not in the law, so you weren't able to apply for an exemption to that law because it didn't exist. Now you can. So if you really feel like all of these concerns, all of the exemptions that are available under that blanket exemption, say you're a group and you're urgently needing to do this work, you aren't paying anyone within your organisation, you don't feel comfortable with applying that exemption to your organisation, you can now go through that process because it is law. So there's a link there, which I might ask Ashley to put into the chat. So basically this will take you to a page that covers off the main details of the order around movement and gathering. It'll take you through that, and then there's basically a box at the bottom and you can put in your reasons for why you are seeking an exemption. And as part of that, you do have to sort of provide exceptional circumstances to why you are seeking this exemption. And you will also need to provide them with a COVID safe plan that you've developed so that they can understand that you are actually looking at taking mitigations against the risk of singing. So this is mainly the information that I'm providing for you is mostly what's available now. There have been a lot of industry developed guidelines, not specifically around singing. However, a lot of the mitigations around physical distancing and other things are included in these. So you can actually find resources at Live Performance. So Live Performance Australia have done some really comprehensive COVID safe plans. They've had these COVID safe plans already checked off by an epidemiologist, an independent epidemiologist, so they're very useful and they're free and available. So I guess the main issue is that for organisations that are very well resourced, you can sort of undertake to do a lot of this work by yourselves, and you might be including mitigations that other organisations can't afford. But these guidelines are there for you to use as a community. So I really urge you to go and have a look at them because they're extremely useful and very comprehensive. So I also do know, actually, if you could post those links into the chat, that'd be great. So basically, everywhere that you work will have a different sort of COVID risk profile. So what you'll notice with New South Wales Health is that most of the guidelines that they develop are for venues. So it's basically about members of the population attending a place. And so they produce guidelines that support those venue operators to understand how to manage people in that environment. So there aren't very many COVID safe plans that pertain to the practice of doing something. So this is where if you were an organisation focused around singing and you don't have a regular venue, you may want to be producing your own COVID safe plan that is just for your practice. But when you go to use a venue, those people running that venue will also have a COVID safe plan. So you need to be able to meet them with those plans together. So if you go to the next slide, Ashley. So if you're a singing organisation or a singing group and you don't have a venue that you particularly use, you want to be sort of developing a plan in and of itself. And within that plan, you're looking after your staff and your workers and your volunteers. And when you go to the venue that you're working in, you also need to understand what they are doing as part of their COVID safe plan. And they're also managing the risk with audience there as well. So that's where the two groups come together. So basically, I'm really happy to talk with you now about the particular questions that you might have. So please do ask some questions in the chat box. And for those of you who may want to, I'm happy to run over the information again as well.
There's no questions just yet, Beck, but I'm going to go back and put all those links in here. Oh, sorry, we have a couple of questions coming in right now. So the first one is from...
It was just about the New South Wales Health link for application for an exemption.
Yes.
You're going to put that on the chat box, yeah.
Yes, sorry, I couldn't copy and paste while sharing, so I'm going to do that right.
Oh, come on.
I know.
Thank you.
Thank you. So let's see, Katrina has asked, does professional include one paid member of the production team or does it have to be one cast member?
No, it could be the production team. So basically, just in order for you to sort of fall under that safe work, it just means someone has to be employed. Yeah.
Cressida from Pinch Gut Opera has asked, so to perform an opera, we apply for an exemption from New South Wales Health as performers. As the performers will be interacting and not 1.5 metres apart.
Cressida, you don't have to, as Pinch Gut, because you're an organisation that employs people, you don't need to apply for an exemption. There is a blanket exemption for professional organisations. You need to produce a COVID safe plan that engages with the risk of singing, but you're exempt as an organisation from that.
Danielle has asked, is there a way to update plans once submitted or do you just need to recreate them?
Yeah, this is unfortunate, but to my knowledge, there isn't a way to do that. So what you would need to do in that instance, and I'd suggest for everyone, is just keep a Word copy of your COVID safe plans that you update, and then copy and paste back into the COVID safe templates that are on the New South Wales Government website.
Hannah has asked, in the venue COVID safe plan for venues, it says where practical on the physical distancing. Which does this apply to?
Yeah, so for that, in venues, I think it's really engaging with where practical. So if you're doing musical theatre and you're swinging someone around while singing to them, then that's not really practical. But you'll need to address that, what you're doing in your other mitigations that you have in your COVID safe plan. But it's also related to audiences as well, I think.
Okay. Ross has asked, we have a community choir and want to stage a performance with a group of more than 30. We do have paid members, conductor. Can we qualify under the blanket exemption?
Yes, I would say that you can.
Okay.
So you still need to, I love that. I love the silent cheering in the background. You're a winner, you're all winners. So I think in this case, you just need to do a COVID safe plan for that project, and make sure that all of your volunteers and all the people that you work with understand that the sort of terms of that plan.
Okay. Would the blanket exemption apply to non-profit chorus group 1 contracted music director? Yeah,
as long as there's somebody in employment, then you could apply that exemption. Sorry.
Rachel has asked, what is the correct distancing between the front of the choir and the back of the musicians performing in the same production?
Yeah, so I guess this is a sort of, again, you are able to sort of manage this through, if you do have someone in that professional category, you can sort of manage that risk. So, you know, that 5 meters is advice. It's in the guidelines. It isn't in the legislation. So you could basically do a risk mitigation around that. Where possible and where practical, it's 5 meters. But if you are trying to undertake a production where you have a shorter space, then you would just need to put that into your COVID safe plan. And if you're in a situation where you feel like you can't do that comfortably, you don't have somebody in employment, you can't sort of take that blanket exemption on, that you might want to apply for an exemption.
Beck, can I just ask a question on that point? It says in the COVID safe plan for venues, have physical distances of 1.5 metres between each other and any other performers. That would probably indicate that you'd need to be 1.5 metres from orchestral members as well, and then 5 metres from the conductor. Is that right?
I mean, it would make sense because of I guess in the way that we think about the aerosol travel. So you basically the aerosols will travel into that person's back. So, but it does say, you know, it does say 5 meters between that person and any other person. But again, if you are part of a professional organisation, you could undertake a risk management process around that and put it into your COVID safe plan and have that distance of 1.5 meters.
Ruth has asked, does professional organisation include community-based organisations that have paid performers as well as volunteer performers? Correct,
yes. If someone is being paid or employed through that process, then yes.
Okay. Could the professional be a contractor rather than employee, which is what you've just addressed? And can the exemption, Glenn has just asked, can the exemption apply to schools, or are the education department updates the ones to look at?
Look, it's there isn't a huge amount of advice at the moment on education, so I might take that question on notice and maybe we can get in touch and I'll try to find out more for you. But it does seem that there's there are less restrictions, it seems, around schools at the moment. So that's all I have at the moment, but I will check in.
Beck, can I ask a question? Just very simply, we're a community organisation and nobody gets paid.
Yeah.
So we have to apply for an exemption, correct?
Look, I'm going to talk to Health today about this, but I think it's basically the purpose of all of this is to cover off most of the bases. And so, you know, I've had this conversation with Health where basically they're saying, look, we want to make sure that most people can undertake to do their work through these different provisions, and that really then we're looking hopefully at a smaller amount of exemptions. So, Rosalind, it might just be worth doing it, and I'm happy to sort of help you through that in terms of, you know, giving you advice around your plan. But it might just make you feel a bit better about moving forward and yeah.
Okay, thank you.
Yeah.
It's Stephen O'Doherty here. Can I drop in on that question?
Yeah, sure.
The Workplace Health and Safety Act actually treats volunteer workers, as it were, in inverted commas, as the same as paid workers. So it would be good for you to check with Health, but from an occupational health and safety point of view, from the legislation point of view, a volunteer is exactly the same as a paid worker, which means that your organisation has responsibilities to look after those people. And Ros, if you've got a committee, if you're some sort of incorporated association or even an unincorporated association with a governance committee, I think that the WH&S Act includes you well within the ambit of this. The Beck would need to check that with Health.
Yes, Stephen, it does. We have a board of management. I'm the president and the chair. And yes, we've been through this in relation to insurance claims. We are, or even though nobody is paid, everybody has to be covered. We have a duty of care to our members as if they are paid workers. Yes, correct. And
Beck, on the question of education, I could probably just help with that for a moment as well.
Yeah, sure.
On the education page, advice for parents, it's fairly clearly laid out there, and there's if you're doing a production in the school, there's a separate piece of advice from the department about staging productions and what you need to do. But the choirs in school settings are very, very open. You can have any number. There's no distancing required, other than I think it's 5 metres to the nearest person facing you, where practicable. So the school advice is very fresh, just came out last Friday. It's being updated again today, I think, to add a couple more words, but it's very open in schools at the moment.
Great, thanks, Stephen. Look, so I'm just working with the advice that I've got from Health, and obviously the exemption has that advice. So I will check in with Safe Work on that issue of volunteer organisations, and it might, you know, Rosalind, it might save you the trouble of applying, but it's just it is an option. I do notice that Justin Boschetti has asked about an exemption that they put in 2 weeks ago. I guess the issue with that, Justin, might be that there wasn't actually any law about singing 2 weeks ago. So, however, as a professional organisation, I think that you actually don't need to get an exemption for what you're proposing. So I might give you a call later today just to cover off that with you. But I think that because they're in your venue, I don't think you actually need to get an exemption for that.
And we've just had a last question from Katrina Beck. Do you just assume the professional exemption, or do you have to notify someone?
There's no one to notify. So I guess the process of notification, I guess, would be through the submission of the COVID safe plan. But again, nobody is checking or looking at those. So again, when the COVID safe plan comes into effect is if something happens in your context. So you really need to make sure that that is up to date, that you have it available, that everybody in your organisation knows what your mitigations are and how you're protecting them and how you're working with them. So when the COVID Safe Plan materialises as if an agent of the government, of health or the police asks to have a look at it. So you just want to make sure that when you hand that over that you're happy that you've covered everything that you possibly could. So it's really based on I guess a trust system, this whole thing that we've got going in New South Wales at the moment. So that's really, I think, most of what I wanted to cover off today. And again, I'm really happy to talk anyone through any other sorts of concerns or issues that you might have that falls outside of this advice. Yeah, so if nobody has any more questions, I'm offering the next, I think, about 15 minutes to look at doing a COVID safe plan and how you do that. But for everyone else, if you just have some questions that maybe or concerns, please don't hesitate to get in contact with me. My details are just there in the chat. So you submit. So there is one more question. You submit your COVID Safe Plan on the New South Wales government website, and I'll just copy and paste that. So basically, that's the link there that will take you to all of the available COVID safety plans for different venues. But for those of you who don't have a venue, there is a general plan that you can look at there and fill in. Yeah, so basically now I can take people that don't know how to do this through submitting that plan, through writing that plan and submitting that plan. And for those of you who don't need to listen to me rabbit on about that, it's been very nice to see you this morning. Happy International Women's Day. Hope you have a good day moving forward. So actually I might now share my screen. Okay, so hopefully you are able to see this screen, which is the New South Wales Government website, which contains all of the information around COVID safety. So on this page, you can find out basically all the steps that you need to go through to write a plan, register, get your QR code, and create the contact numbers for your contact tracing. Okay, so basically these plans have been developed by New South Wales Health to provide guidance to businesses that are undertaking to do work during the pandemic. And they're basically there to help you, as a guide, to help you to minimise risks. So as part of this, there's a range of plans that that have been developed, and you'll see they're alphabetised here, and the popular ones are at the top. And I think these ones that we'll have a look at today are the ones that are up the top here, which is the community centres and halls and the general safety plan. So all of the other industries are here. The other one that we sort of tend to look at quite a lot is cinemas, theatres and concert halls, function centres, and major recreation facilities and museums and galleries. So those are the ones that I'm looking at mostly for the arts sector. So when you've found the plan that you want to use, and for the purposes of this, I'm going to go to community centres and halls. You click through that, and then it will take you through some basics. So in the first instance, it'll cover off your maximum capacities. So at the moment, we are in the 1 person per 2 square metres of publicly accessible space. So when we're talking publicly accessible space, we're not talking about areas that are off limits to people who would be coming into the venue as a regular punter. So for instance, if you do have backstage areas, anything like that, they don't count towards capacity. Also, another thing to be really clear about as well is that your workers don't count towards capacity. So only the people that are coming in to use the venue as an audience would be counted towards the capacity. So all of your workers and your volunteers, basically they are coming in as workers, and so that you don't have to count them. So if you are a community centre, you have to, and basically any place where you're inviting members of the public inside, you need to do a COVID safe plan. So how you do your COVID safe plan is also within this document. So I would recommend that once you've had a look at this, that you set up a Microsoft Word or other sort of word processing document, and just cut and paste the things out, because as we know with this pandemic, things change all the time. You want to be able to update your plans. There is no way that you can update a plan inside this context at the moment. So you do need to sort of update it and stay on top of the public health orders. So these are basically the issues that you need to sort of look at. Is physical distancing. So these are the things that sort of change a bit. So you want to sort of stay on top of what's going on currently in relation to physical distancing, square meterage, face masks, self-isolation and quarantine. So once you've got to this page, you click through here to complete a COVID safety plan. It doesn't want to click. Why doesn't it want to click? Okay. All right. So basically, there is an option to print this out as well once you've done it, so that you have a hard copy available to you. So basically, with all COVID safety plans, they're all exactly the same. So even the ones that have, you know, different venues attached to them, you all have the same kind of subjects to look at. And the first is the wellbeing of staff and customers. So staff, including your volunteers, and in your case, your performers, the people who work with you. You need to cover off physical distancing, hygiene and cleaning, and record keeping. So you need to, so it is actually in the public health order that you must complete one of these plans if you are a listed kind of venue within that public health order. So your basic information goes in here, and this is where we start with wellbeing of staff and customers. So I'll just take you through this. So the first one is to exclude people who are not well. So I think this is a really important point in the sort of community choir context, is that you sort of really make it clear to people that if they're not well, don't come to choir. And you can find a way to connect after they've got better. So if you have staff, you might want to undertake some training with them about COVID-19 and how to manage the people coming to your performance. Again, about staff and leave entitlement. So if people feel sick, they should be encouraged to stay home. And if you have a venue, you might want to put your conditions of entry on the front of your venue. And also when you do register, there are other sorts of materials that will become available to you, which you might be able to download and utilise, including COVID safe signage and how many people are allowed on the premises and things like that. So this is just some more information about other venues or facilities within a facility. So a lot of community centres do have other types of venues inside them, and so they need to be looking at the particular plans for that. So if your community centre has a theatre, an auditorium inside it, then that auditorium and the people who run that would need to be looking at that COVID safety plan. Okay, so I guess the important one for us is physical distancing. So at the moment, in general, for all indoor venues, the capacity limit mustn't exceed 1 person per 2 square metres, and children count towards that limit. And we want to still be talking about physical distancing as one of these sort of first priorities in terms of mitigating risk. So at points between points of mixing, so where you have pinch points in areas, between seated groups, and if you've got staff, that they have enough space between them as they're working. And you have strategies in place to manage gatherings outside of a venue, reducing crowding, and making communal areas also physically distant. And so further down here, there'll be a whole range of things that may or may not be applicable to you, but you probably do need to address them, even if you're just saying this isn't applicable to our venue. Here is the information about singing. So the information about singing is contained within the community hall's COVID safe plan. So this is where you address what you're doing. So this is basically the same information as I showed on the slide deck. The third part is about hygiene and cleaning. So that's just basic kind of questions and information about what you should be doing there, providing hand sanitizer, making sure your bathrooms are cleaned and well stocked, that kind of thing. Covering sort of areas that are touched frequently.
Could I just ask a question? So do we write in the boxes, or do you have to fill in every box, or do you copy and paste what's above the box into there, or we will encourage contactless payment options? Is that you just making a statement that mirrors what's written above the box?
It depends on how far you want to go in your plan. So I always just suggest that, imagine the police are at your door asking you for your COVID safe plan. What do you want it to say to them? Right. But you know, if you don't have, if you're using a space that doesn't have particular facilities, you could just put not applicable.
Yeah.
But I just think, and also a lot of people have plans that are sort of separate from this kind of situation. So they might have something that they lodge, but they don't lodge it in this form. But I have to admit that I haven't actually gone through this process myself yet to see what actually happens. But I'll take us through that when I'll click on the email as PDF. So I think what you can do then is send it to yourself.
Beck, I was just going to ask in relation to that, the box about the 30 singers, do you just put in there that as a professional organisation we're covered by the exemption? Is that essentially where you... Yeah.
And you might also want to say, you know, in between singing, we are maintaining physical distance. You know, our cohort is keeping us up to date with their health. We're taking temperatures on entry, you know, things like that. You might be doing other risk mitigations there. So that's where you put the information. So you also can get a QR code through this process. So when you submit this plan, you can then they will email you back your own specific QR code, and you're able to then, if you're undertaking rehearsals and things like that, then there's a record management system that you don't have to undertake yourself there. So once you've done that, you can email this PDF to yourself, but then going back, you can register. So basically in this, you are agreeing to keep a copy of your plan. You're entering your business details, and then you're submitting that. So it isn't a situation where you're submitting the actual plan to them. You're submitting that you have done one. So basically that's the next step for you, is to do that. And once you've actually submitted that, they'll actually send you a QR code as well. So that's the main detail on the COVID safe plan, and I am really happy to talk to anyone about submitting this. So if you do have any concerns about any of those fields and the things that you're obliged to answer under that public health order, I'm very happy to take questions on it.
Beck, do you recommend using the QR code for rehearsals for cast and team coming in and out, or is it just for audience?
It's really for audience, but I think a lot of businesses are using it at the moment to just in general, so that people can sort of log in when they come in. It just means that, so basically what happens in that case is that if something is identified at your venue, say you're using a community hall that's used by a lot of people, that they can just check in with the community hall's QR code and they're in. If it's just you, it's probably because you're not a business, I don't think you're obliged to do, because if you're just a group and not a business, you wouldn't be obliged to keep that information if you were just sort of rehearsing together as a group. But I kind of feel like it's a good idea to do it and to just get people used to doing it, because as we know with this pandemic, things can quickly flip into another mode, and you might be required to do it by law. So I think it's a good idea to do that if you can.
Okay, thank you.
I just asked a similar question. Do you use the QR code for the venue, or do you use one for the business? So if we were coming into a venue, do we need to QR code in to that venue as well as within our own organisation?
I think it wouldn't be necessary if you're using a venue that someone else is to manage. New South Wales Health will go to that venue for that information. Okay. Because basically that information is all time coded, so people can tell, New South Wales Health can tell when people have gone into the venue, and they just have one contact there at the venue for that QR code. But if you're the only group using a particular space, like a church or something like that, that's decommissioned, or you might want to download your own QR code in that way. Yeah.
Beck, look, there's just a few questions in the chat which we might just go over just to rehash. Do performers count towards the capacity limits?
No.
No. If we are doing a series of performances in different venues, do we need to prepare and submit a separate plan for each performance?
I think it depends on if they're a professional venue, that venue will have its own plan. If you're doing a performance that is radically different from other performances, then you might want to do separate plans for those performances. I think if you're a business undertaking this, it's good to have a plan for different performances. You might have it if you're a choir and you're doing something very simple in that way, with people lined up 1.5 meters away from each other, and that's the way that you do things, then you can probably just have one plan. But if you're going from doing that to a musical number with dancing and movement, then you might want to do another plan. But it depends on whether your mitigations change radically in that as well, I think.
And that's all the questions, Beck.
Yeah, so as I say, if anything else you need information, clarification, support, please don't hesitate to get in touch. And hopefully this the law actually provides you a few more options now and a bit more clarity with what you can do. Yeah. But it's very nice to see all your faces, and look forward to catching up with you in the world, hopefully. But yeah, do get in touch if you need any support. Thank you. Thanks.